I'd like to acknowledge my colleagues at Monash University, particularly Claire Palermo, and also my colleagues within the Healthy Together La Trobe initiative, which is a partnership project between La Trobe Community Health Service and La Trobe City Council. So currently my role is 0.5 sitting at Monash University and 0.5 sitting at La Trobe City Council. Okay, so I'll give you a very quick overview of the Healthy Together Victoria initiative and how it utilises systems thinking. I'll share some information about La Trobe City, where I do a lot of my work, and I'll take you through a local application of the Healthy Food Connect framework. Okay, so Healthy Together Victoria utilises systems thinking to address the underlying causes of chronic disease, and it particularly focuses on smoking, poor nutrition, alcohol misuse and physical inactivity. It aligns with legislatively driven strategic planning processes. So the Victorian Public Health and Wellbeing Act of 2008, the Victorian Public Health and Wellbeing Plan, as well as local government municipal public health and wellbeing plans. Okay, so systems thinking recognises the dynamic interactions between issues and circumstances, and it identifies unique elements and complexities that exist within settings and different population groups. So it involves understanding how they continuously change and affect one another and create a complex network of interaction. So Healthy Together Victoria has resulted in a large investment in prevention infrastructure in 12 local community areas, and the estimated reach is 1.3 million Victorians. So the focus of today's presentation will be in the city of La Trobe, which is one of these communities. La Trobe City is about 150 kilometres east of Melbourne in the centre of Gippsland. It has the 7th lowest socioeconomic index for advantage rating out of 80 in Victoria, which is exemplified by lower than average weekly income, lower educational qualifications and a higher unemployment rate than the Victorian average. It has large brown coal reserves, therefore supplies 90% of Victoria's electricity requirements. And it is the home of Morwell, which probably hit the news in New South Wales. There was a very large mine fire there, and it was a very unpleasant place to work for about a month because of it. 75% of Gippsland adults are either overweight or obese, which is the highest rate in Victoria. So just funneling down to La Trobe City, it has a 10% higher rate of overweight and obesity than the Victorian average. Fruit and vegetable consumption, whilst higher than the Victorian average, is still very low, and more La Trobe residents drink soft drinks daily. Okay, so while saying that previously there were few long-term sustainable solutions to addressing these issues, I would like to really acknowledge the hard work of especially La Trobe Community Health Service and the local primary care partnership in really starting the work that I've managed to continue on with. The work has tended to be more of a program focus, focusing on group and individual behaviour change, rather than focusing on creating the supportive environments that influence population level change. So basically, as Leah said, making the healthiest choice the easiest choice. So in order to progress this work, Healthy Together La Trobe partnered with Monash University to create my position. So it focuses on practice-based research and provides a real focal point for food system action. And it employs a mix of strategies approached from different angles at multiple levels at the same time. It involves cooperation between people and organisations from multiple sectors, engagement of influential local stakeholders to drive efforts, and an integration between local community efforts and statewide plans and policies. So it basically means that I am very, very busy. So this is the framework of Healthy Together Victoria, and you'll see that it really follows a settings approach to prevention. So there's dedicated workers in workplaces, in schools, and in different community settings. And I'm just going to take you through the Healthy Food Connect framework, which is just a component of a multitude of strategies that are occurring in each of these Healthy Together communities. So the first element of the Healthy Food Connect model is to undertake a local food access needs assessment. And we did this in Latrobe by utilising the food system scanning tool, which is through the Victorian Local Governance Association. It's based on the Environments for Health framework, which looks at the built social, cultural, natural and economic environments in a municipality. And the aim was to gain a greater understanding of the environmental determinants of the Latrobe food system. I was very fortunate, given that I sit with Monash University, to have access to fantastic students. So I had 4 nutrition and dietetics students last year, and they helped me to conduct 121 semi-structured interviews with a broad range of food system stakeholders. We utilised snowball sampling procedures, so they would inform us of other stakeholders to interview. We also, as I mentioned, built upon existing data and previous local food security research, and we had a look at what current plans and policies existed locally, especially from Latrobe City Council. And we had a look at 529 of these policies, and a lot of it was doing Control F for words such as food, nutrition, that sort of thing. And we found there was very, very little mention of food, and which is quite surprising for me for a rural area. Okay, so these are some examples of teams and divisions within Latrobe City Council that we consulted with. So we went right from the top. We had briefings with the CEO and Mayor, the senior leadership and exec team, and also the different divisions who we saw can potentially impact on the food system, and a lot of these divisions really represents the social determinants of health. And these are examples of the 121 stakeholders that we consulted with. So it was from all levels of the food system, from primary production right through to agencies that have food literacy programs. And just in the primary production side of things, because Latrobe City has a lot of focus on power generation, there actually isn't a lot of agriculture. We're surrounded by an agricultural region, but in the municipality itself, we found very few fruit and vegetable producers. There's an excellent free-range egg producer, which is a strong partner of ours now. So the next component of the model is to identify and prioritise actions. So we did this by bringing together those that we consulted with at a big forum in December last year. We managed to get 84 attendees from right across the food system. And in the morning session, what myself and our students did was some thematic analysis of their responses, and identified 12 food system opportunities that they'd told us. And we also showcased 4 local food system strategies that were already occurring in the region. And then in the afternoon session, we asked a lot of these stakeholders to help us with facilitating focus groups, which focused on each of those 12 opportunities. Okay, so basically the key themes emerging from the forum were that system level change can only occur by employing multiple strategies concurrently. So thereby increasing the reach of what we do and really having that saturation of the message. So for example, if a child in school has a healthy canteen policy and then the milk bar next door to the school supplies fruit and vegetables, and then there's a social marketing campaign, and the more times that someone hears about our healthy messages, the more chance it's going to influence behaviour change. We've also found that the best strategies have co-benefits, and we found there was real energy across settings. We had great representation from schools, workplaces and the community. But we found there was a real need to capitalise on the interest and momentum, and not just to have a big talk fest. There was really great media coverage. So the students did, as part of their mapping, they found that the region had 79 takeaway outlets and just 3 greengrocers. The media loved that statistic. We also found that 3 greengrocers had closed down in the past year as well. So we got in the local paper. We actually, with the Gippsland ABC radio, they set up a food challenge and utilised some of the information from the Monash Healthy Food Basket Survey in what might be left for food for someone on Centrelink benefits, and one of their presenters set herself a challenge to try and eat 2 fruit and 5 veg every day on a budget of about, say, $40 for the week. And she had video diaries, and I called in to see how she was going, and it was really great. And their Facebook page was really active, and people just talking about their experiencing with accessing healthy food and how it can be more expensive for them. Okay, so the next component is to form a local food coalition. And we are currently underway with doing this locally. So we've had 2 follow-up food system strategy planning meetings, which has attracted 33 different stakeholders. We currently have 120 people on an email list, and I'm right now doing an evaluation to try and determine what the ideal structure is for moving forward. Just preliminarily, I'm finding that people don't want to meet just to talk. People want to have strategy-focused working groups. And we're determining how often we should run these. We're also going to work with another online portal through Sustainability Gippsland to have the Latrobe Food Coalition online as well. Okay, so I'm just going to take you through, very briefly, some of the healthy food access initiatives that we've started. Okay, so in terms of the built environment, and have another student at the moment, and she's working to map food access and availability and affordability in Latrobe City. So we're working with our GIS mapping department. Just hot off the press on Friday, we've actually found that in the year, since we had our 79 takeaway outlets, we've actually now got 89, which is not very good. We've used our data from our economic development and our EHOs, our environmental health team at council. And we've also just done used the Victorian Healthy Food Basket Survey, and we've found that the cost of food has gone up. And it's about, for a family of 4, it would cost about a third of their income if they were on Centrelink benefits to eat or consume the items in the basket. And in our recent surveys, we've actually looked at the fruit and vegetable component of the basket, and we've found that our 3 greengrocers are actually cheaper than the supermarkets. Just for the fruit and vegetable component. So we're going to use this as an opportunity to potentially partner with them by saying, you guys are cheaper, how can we work together with you? Because obviously they're a major place where people can actually access fruit and vegetables. I'll talk a bit later about how we're embedding the food system into local plans and policies. So in terms of the natural environment, we've started a network called Growing Together Latrobe, which is one of those strategy-focused working groups that I mentioned previously. We've got 6 community gardens in the region, and the great thing is that they've all emerged not as local government initiatives, not as community health initiatives. They've been driven by the community themselves. And the VRI Produce Garden is really fantastic. They've done crowdfunding, and they have really grand plans to try and produce food at scale. And also, it's great me sitting at council because I can establish links with the likes of our sort of planning teams, our parks and gardens teams. Parks and Gardens have a great initiative called My Parks, which is working with primary schools to plant edibles on council land, so establishing mini fruit forests and planting perennial vegetables. As part of this mine fire recovery efforts, we've had a whole heap of trees donated through the DEPI, Department of Environment and Industry, and we've managed to influence that to actually get some fruit trees as part of that. So we're going to be planting those on council land as well, which is really great. In terms of the economic environment, we're doing a lot of work with retailers and workplaces. So more students at the start of this year did a project called Catering for Healthier Workplaces, and their aim was to investigate the supply and demand of healthy food in Latrobe City by interviewing 16 caterers and 19 workplaces. And what we've found is that quite a few are really ready to make healthy changes. So we're using the Victorian Government's Healthy Choices, Healthy Eating Policy and Catering Guide for Workplaces as our guide, and assisting these workplaces to implement healthy catering policies. And a lot of these workplaces are the major ones in town, so our power generators, which do employ a lot of people who are at risk of experiencing nutritional issues, and also working with really large workplaces like Australian Paper Mill, ASIC. They have a major centre as well. Also, we're supporting food retailers and sporting clubs to provide healthier options. So we're utilising the Heart Foundation Healthier Oils initiative, and we've got our environmental health team who routinely inspects our caterers. They're going to be looking for what type of oil they supply or they're using, and we'll be running workshops for those who are keen to make the switch to a healthier oil. And we're also working with our sporting clubs and our Latrobe leisure facilities as well to improve their club canteens. And we're working with our neighbouring LGAs, including East Gippsland, about establishing links between produce that they provide and supplying, say, the likes of our major workplaces to have more local options available in their canteens. So social environment, there's a whole heap of food literacy initiatives that are occurring. I won't go into them in more detail. We had the Jamie's Ministry of Food Mobile Kitchen come along last year. We had 450 people go through that. Food literacy is great, but we really need a coordinated approach to what's previously been quite disparate initiatives. So we really need to embed them within our broader systems work. And then our last element is to include healthy food access in local government policy and planning. So one of our major achievements has been able to embed an eating well priority within the Latrobe City Council Municipal Public Health and Wellbeing Plan, which was adopted last December. And the action plan outlines everything that I've talked to you about today. We've also influenced the Latrobe Planning Scheme Review, which was really galvanised by a planning permit from McDonald's to build a 4th McDonald's in the municipality. Of course, we didn't win, but we got the local councillors talking. We got our language within the review document talking about obesogenic environments. But until the Victorian planning scheme sort of provides the blueprint, we've got very little chance of making that impact at a local level. We've also influenced the Latrobe City catering and grocery supply tender, and we've embedded in the evaluation criteria, there's the traffic light system. So the ones who go for the tender, the caterers, have to supply healthy options. And we're currently reviewing all of the council divisional business plans and identifying food system leverage points within them. So in conclusion, you can see here, this is just a picture of representation and collaboration of stakeholders from across the food system. And really by following this cross-sectional systems approach, together with having supportive plans and policy, we've got more of a chance of positively impacting the local food environment. Thank you. And there's my contact details should anyone wish to get in touch.
Thank you very much, Julia.